Hey everybody, Kelly Davis here, the owner of Skin Essentials Luxury Med Spa and Salon. You may have seen yesterday we did some demos, some live demos of actual treatments doing body contouring. Today we're doing a training here because we just want to go over each body type and just kind of see like what treatments they actually need, because a lot of times people might think, oh, I need Coolsculpting, I need EmSculptNEO, I need Quo, and a lot of times you might need all that, but you might need something else. We layer treatments around here, so that's what today's all about. We've been doing some training on the back end, and now we're actually going to do hands-on consults. So we just thought you could watch us while you see what I do and see how I decide what the treatment plans are, because to me this is super fun and I love changing bodies. I'm actually the national trainer for BTL, which is the EmSculptNEO, EmSculptNEO, EmTone, EmFem, and also for Coolsculpting. I've been on the advisory board for Coolsculpting for the past 3 years. So I love body contouring. I love everything about this industry. So I'm ready to teach these girls and teach y'all if you want to learn a little bit more. Are y'all ready?
We're ready.
Okay, so go ahead and take your robe off. Okay, so when you look in the mirror, what bothers you the most?
I would say like my muffin top, like my belly right here, and my love handles.
Okay, so your love handles you don't really love.
Right.
Okay, yeah, me neither. Okay, so you said love handles and muffin top. Is it kind of the same thing that you're talking about?
I guess so. Like for me, it's just here, this excess, and my sides right here.
Okay, all right. So let's see, take a look. And I don't wear gloves whenever I'm pinching fat because it's hard for me to really tell how many cycles we need to use. So we've already talked about this. Whenever it's no different than getting a massage. So I like to be able to really grasp the skin and the fat so that I can see what treatments we actually need to do. So, okay, turn this way for me. So is there anything else? So basically, like when you look in the mirror, you're telling me that your stomach and your sides bother you.
Mm-hmm.
What about how your pants fit you? Does that have any bearing on your sides at all?
I feel like my sides kind of pop out a little bit.
Okay, where do they pop out? Is it more like on the side or more in the back?
I would say like the side.
Okay, all right, awesome. Okay, so turn around this way for me. All right, so now let's just see. Okay, so whenever I'm doing this, you can see I just kind of want to pinch through. And actually, I want y'all to get your hands in here. Every time we're doing, whenever we're doing sides like this, you can feel, like if you feel right in here, it's not gonna be as pinchable. So it's more fibrous, right? And then if you like pinch right over in here, you're gonna see that it's more the adipose fat. So just, I want y'all to take a feel of that just so that you can see what I'm talking about.
Sorry if I hurt you. Oh yeah.
See the difference?
Yeah.
And that's pretty common for this area right here to have like a more fibrous feel to it. We still can Coolsculpt, but again, the Coolsculpting goes after the adipose fat. So we always like to be transparent to let them know they're not gonna get as drastic of a result right here as they would like where you can actually pinch a little bit more. So I want y'all to feel too.
Okay. Yeah.
See what I'm talking about?
Mm-hmm.
Mm-hmm. Kendra, you're probably familiar with that already. Yep. So I still would Coolsculpt this, but kind of what my rule of thumb is, whenever I'm doing Coolsculpting, if I can, so see how whenever I pinch, and again, whenever you're doing a consult, you can't be shy. So when I pinch and the fat does not come all the way back to my hand, that tells me that I'm probably gonna do one treatment on them.
Mm-hmm.
So if I pinch and see even that might be 2 treatments. You can see how it comes back further. You're probably gonna do 2 if we were doing right there. Again, right now she told me she just wants me to work on this, but also because I really, when I start analyzing and looking at the body, if we kind of get rid of this, she doesn't see this back here. It's a different area. I would recommend that we do a cycle right here, because can you imagine if we kind of get this, we already see she's got a nice waistline. So now what if we kind of push that in just a little bit, because that's what one cycle would do for her. Really, it would really accentuate her waistline.
Yeah.
So again, she came and she told me this and this, but as I'm consulting her, I probably would take a picture of her back and just show her that I would also recommend doing these 2 right here as well. Just because we're artists and we want to basically paint the picture. And I think that if we kind of did this, and also you can see if we get rid of some of this, see how it kind of makes her look more square. Does that make sense? So if you kind of push that down, where did her waistline go? So if we want to get rid of some of this, then if we do this too, then you're now going to have her waistline show. Does that kind of make sense? Why I would make that part of my treatment plan? Okay, so let's see, do sideways quarter for me about right here. Okay, so we know that the cycles are gonna be like this or like this, just depending on which handpiece we're gonna use. So that's when I would kind of decide like, what am I gonna do? So I would probably do one cycle there. And again, whenever I'm looking at this would be considered one area. Remember we talked about the line of demarcation? You can actually do this completely separate and not have an issue. So if we don't treat that area at the same time, it's not gonna be a line of demarcation because this is one area and this is two. However, when we're doing her abdomen, we would have to watch where our cycles go so that we don't have that line of demarcation. Does that kind of make sense? Okay, so by looking, and also you can see like this would actually probably be two cycles, stacked on top of each other, but because you just don't have, like, see how we really can't pinch right there? So really probably what I would do is do something more like right there. Can you kind of see like, can't pinch much there, can't pinch much there. So I'd focus like right there, and that's where I would put that cycle. I would try to put the Cool Advantage, but she's probably gonna be a petite, okay? So, and I would tell them that too. I would say, I'm gonna try to put the medium-sized applicator on you. If it won't set on her body and like pull everything in and stay closed, then I would go ahead and go to the petite, because she's kind of in between. Does that kind of make sense? Okay, so there would be one there. All right, now let's see. So we know also, again, this is kind of in the back part, but we also know from the front, we saw a little bit right here. So I'm going to see where her lay is.
Ticklish.
Sorry. Whenever we actually do the treatment, we have to massage you. It's right in here is always real ticklish for everybody. So again, you can see not much, and again, sorry. And you have again, we're just not being able to pinch that much. So this is where we get. So right here, this would be another cycle. So far we've got one cycle right here and one right there. All right, turn around, let's just see. A lot of times people are uneven, and by looking at her, can y'all see that we are a little bit uneven? Tell me what y'all see.
Higher on the side.
And see how it's more, do you see how we're a little bit more right there? Again, it's the reason we don't ever notice that until we're looking to do a consult like this. And so what I always would tell a patient also is we're gonna do one round, depending on what it ends up looking like, we may go back and just do one on this side to even things out. And that happens a lot, okay? And then also what'll happen when you start drawing, you'll see, cause I can already see like right here, she's more in the front right here with this bulge, and then she's more in the back. Yeah, and so it's not usually, and again, what I tell everybody is draw a line of symmetry down the middle of your body. We're sisters, we're not twins, right? Everything's gonna be a little different, and you don't ever notice it until you start getting in and pinching and feeling and all that. So let's see. All right, turn sideways for me. Turn a little bit more. So this side. Yeah, see, and you can see we can grab a little bit more on this side too. So we probably, on this one, because look how much we can grab, I think we would definitely get the Cool Advantage right in through there. So this side is gonna maybe be Cool Advantage, probably petite. This side we're gonna be Cool Advantage. Do y'all see kind of where it lays? All right, so then, same thing. Sorry, I know you're gonna be ticklish. So we know. Let me see, turn around and face me real quick. So her bulge is right there. So again, it's not as pinchable as I want it, but this is what we have to take care of to make it look right. Like again, you saw kind of where my hands went, like this is where I can get more bulge, but or more suction, more pull, but that's not gonna do what she wants to do for this right here. But since I feel that actually kind of goes into this part right here. And so that actually might be 1 and then 2. You know what I'm saying? Like, so to do this, and then like imagine like if we cut in all that, like what that would make, and then especially once we start doing her stomach, you know. So
well, that would even out her waistline to this side.
So yeah, so we're definitely gonna do 1 there, and this would be a good example of actually very potentially we could put the smooth right there. Because it would cover a little bit more. She's got a little bit more surface area right there. And I feel like the smooth works better because remember we'll use the smooth right here on this. So I feel like the smooth works really good. Sorry, I don't mean to keep touching. You're like, I'm being tickled. I think the smooth would actually be a good option for right there. So still 4 cycles, but I would do 2 Cool Advantage, potentially Petite, Cool Advantage, and then I think the smooth. What do you think, Kendra?
I think,
Because you know, you're familiar with the hand pieces. Don't you think that smooth would be so awesome right there? Yeah, I think so. Okay, so then for your stomach, I think the EmSculptNEO would be really good for your stomach. And the reason why is because you do have some fat, but I also can feel, and y'all can see a little bit too, she has some adipose fat, but I can also feel a little bit of the visceral fat in there. So y'all take a feel for me, so you can see what I'm talking about. Yeah.
Oh, okay. Yeah.
So I think the EmSculptNEO would be good because the RF is gonna get rid of the fat, and then we're gonna get the muscle tone at the same time. So we talked about how when you're building that muscle, it helps reduce the fat, or it's gonna keep burning the fat. So I would actually start her off with, and I would do 2 paddles per treatment with her, just because she's a little bit wider. You could actually do 1 paddle here and 1 paddle there.
Okay.
You know, and that would basically cover this whole area right here, and you know, give her. So I really think that would give her. I think that would give really good results for that. So what I would tell her is we're gonna do 4 and Coolsculpting. I would do 4 cycles if we're just gonna do this area right here. I would tell her that we probably might have to do a second treatment right here, but with that smooth, maybe not, you know, because again, if it's a little different, it's not going to be, as long as it's not sticking out too much, it might be fine. So I'll tell her we might end up having to. I wouldn't pre-sell that because there's not as big of a difference. I mean, sometimes I see a really big drastic difference where I would make sure we have enough to go ahead and cover that. I would also, because we know that the cycle price starts having discounts at 6 cycles, so I would recommend we go ahead and grab those other 2 cycles for her back, because it probably end up costing her close to the same amount with the rebates that we have and going down on the cycle price a little bit. So I would recommend that, and show, you know, again, show the pricing on here's 4, here's 6, and you know, here's why, and then the package of 4 with the EmSculptNEO. And again, with you doing the double paddles, that's considered 1 session. So that's what I would start with on you. And you don't have, I think your skin's smooth, so I don't see any reason for EmTone or Quo or anything like that. So, okay, what do you wanna? Do we have any hand sanitizer behind the EmTone door?
Yes.
Awesome. And then I'll give you some too. All right, who's next? You ready?
Yes.
You ready?
I'm ready. Want some? Sure. Thank you.
Okay, so you're tiny, and so people probably wonder, like, why would you want to do anything? But tell me, what bothers you when you look in the mirror?
What bothers me the most when I look in the mirror is my buttocks.
Okay, what about
I
it?
want more of a lift.
More of a lift?
More of a lift.
Okay, all right, turn around, let's take a look. Let's see, I'm gonna look at you this way. Well, I think you have a pretty cute butt, but
Thank you.
no, that's about it. Okay, so here's what I want y'all to see. If y'all want to kind of come this way for me. So she says, again, y'all hear me kind of make jokes about the yeah, that's fine. Y'all hear me kind of make jokes about the mom butt. Again, she already has some kind of lift, but do you see how we have this right here? Well, I'm fixing a pinch, but what if we did Coolsculpting her banana rolls to get rid of that pocket of fat. And then we did the EmSculpt to lift her up just a little bit, you know? All right, so turn around, let me see real quick. So, and you can even see the pocket of fat right there. Not that it's much, but it's a little bit.
Yeah, I can see it when I wear like my yoga pants and stuff. I see that it sits right there in that crease.
Yeah, I mean, it's not much. Okay, so what I'm gonna let y'all pinch and feel too, but what I'm also seeing right here, see when I pinch this, cause again, it's not much fat, so there's a little combination of some skin, even though you can't see it, she looks real smooth, but when I pinch like this, I'm seeing a little bit of skin laxity. Do y'all see that? A little bit of skin laxity and a combination of a little bit of fat. So for this, I would, you know, we could do the petite, that's all that's gonna fit on her is 1 cycle each of the petite, but we're also probably gonna wanna do EmTone, and again, it doesn't, I mean, you could probably do EmTone up into here, just cause you see a little bit of skin laxity, but I feel like once we do the Coolsculpting on her, because again, y'all can see, like when you pinch, see that little bit of skin laxity up in there? Now I want y'all to take a feel too, cause you're also gonna be able to see when you feel it, you're gonna be able to see, you're gonna be able to feel it a little bit more also whenever you do a pinch. So go ahead, y'all get your hands in there.
Oh yeah.
Yeah.
You can feel it when
Mhm.
you do it.
Yeah, you can't, it's not, see,
Yeah,
you can't really see it, but
unless
once you,
pinch it,
right,
then
and
you
just
can feel
knowing,
it.
yeah,
Oh, yeah.
and then just knowing what the machine does, it's like part of it is the skin laxity and part of it is actual fat.
Yeah.
So yeah, and then we know what the EmSculptNEO does, it like does those nice butt lifts, so for her, it would be 2 cycles of Coolsculpting, we would do a session of 4 for the EmSculptNEO, and then also what we talked about too with the EmSculptNEO, that you maintenance them once a month at least, so we put them on the membership, and then I would EmTone her, so the EmTone would be, you could actually Coolsculpt her, EmSculptNEO and EmTone all in the same day, and the order would be Coolsculpt first, then we put the EmSculptNEO on her, and then we would EmTone that. And so the EmTone would be 4 sessions also, and so you would actually, so then the next week she'd come back EmSculptNEO, EmTone, and then do that the same next week, and then the next week. And then after that, the EmTone would need to be possibly, you know, just depending on how she sculpts out, but maybe once she starts getting that butt lift, and so, cause Coolsculpting, we also know sometimes, helps with the skin laxity a little bit also. So she may not have to continue the EmTone, that would be something that I'd probably sell her a package of 4, knowing that she does need to keep doing the EmSculptNEO, knowing that Coolsculpting takes, you know, 30 days to 120 days to get your full results. So, so I wouldn't sell her any more EmTone, I'd let her fully heal out and kind of watch it as we go. You know, if, you know, we get into month 3 and she has skin laxity and it's not doing everything that I think it's going to, we can add the EmTone back in. Okay, that makes sense to everybody? All right.
I'll go
Okay,
next.
okay, let's do the hand sanitizer real quick. Even though we're all sisters around here.
I
but-
know, right?
I didn't see each other doesn't work.
Okay.
Like I'm spraying it on your dress and on your hands.
No, I'm good.
Okay,
All right, you ready, Maddie?
I'm ready. Well, maybe. This thing's big. Okay.
All right. When you look in the mirror, what bothers you?
I would say, like my top thing, or can I name 2?
You can tell me everything about it that you don't like. I'll consult your whole body.
I think that I'm kind of built, and this may be really funny to you, but like a box of cereal.
Okay.
So that, and then my legs are so skinny down here, but they're not up here,
Okay.
and that bothers me.
Okay. So basically, what I'm hearing you say is your sides. You want maybe more of a weight, like maybe some of this gone, and maybe like a little bit more of a waistline.
Yeah.
Okay. Does your, not that you have much, but does this little bit of pooch right here? Does that bother you at all?
It does, but not as much
Not
as
as much
like
as it-
not having as much shape.
Okay. So more. So you're looking for more an hourglass shape
Right.
for your waistline. Okay. And then when you say your legs, does the inner thighs or outer thighs bother you, or both, or do you not really know or care?
It's my inner thighs.
Your inner thighs
for
bother
sure.
you? Okay. All right, so turn around and face me real quick. Let's look at that. And if y'all wanna come over here so you can kind of see what I see. And again, we talked about that imaginary line, everything being a little different on each side. You can see there's your bulge right here, and here's your bulge. You can see it's a little different, right? We already have a little bit more of a waistline here, so that tells me that we need to do something probably about right there. Do you see that? So if we could do something right about right there, that's gonna be good. And then it looks like something about right here and right here. So this might be a case where we do, and I'm fixing to look at everything from the back, but it might be 1, 2, you know, like not mess with something right on here. So we'll look at the back and kind of see, but from the front, I can definitely tell that's what we gotta do from the front to give her that little bit of waistline. Y'all see that? All right, so turn sideways for me. Nope, sideways. Don't be trying to twist and turn on me yet. So definitely one right there. And that would probably be a cool advantage. And she's actually pinchable pretty much all the way through. You can feel right there is where that fibrous starts. But we definitely could fit a cool advantage right there. And then, let's see, turn right here for me. So if I do that. So you can see, do you like your pants, do they, oh, you're a little uneven too right here. Do your pants bother you? Like, do they cut off right here or anything? Like cut your, like do you hang over it all on your pants?
I wear high-waisted pants.
Okay, to cover that. And actually, she's actually less fibrous than what I thought. So so I would definitely do one, and then look, you can see that right there too. And then, let me see something real quick. Yep. So then y'all see this right here? Remember, that's what we needed to do. So this right here. So this side would actually be 3. Okay. Did y'all kind of see what I did? So we're gonna grab right here. That's gonna be 1. And then you can see we still have this, and you kind of follow what the line is. That's 2. I mean, actually, this is gonna be really good. It's nice and pinchable. And then because we want that waistline, you can see right here, we can do that. So there we go. What does that look like to you? That side. And see, even by y'all look in the mirror. See, even by just me doing this, how it evens out. You can tell there's quite a bit more on this side than on that side.
Yeah.
You see, because that's kind of me kind of pulling everything back. That's what it's gonna almost look like with 3. Does that kind of, y'all kind of see that? Yeah. Okay, so let's see here. Turn this way for me. So yeah, 1 there, and then and 1 there. See, and I wouldn't do this one yet. I would do the 1 and 2. I would do 3 on that side, because you can even see if you're looking. Do you see right there? See how there's fat right there and it's not right there? So you can visibly see that. So yeah, I wouldn't I mean, again, obviously we can come up here and do that, but I don't think it's necessary, especially by what she told me. So yeah, I would do the 3. So she would be 5. And then, and I know that I said, like, so if you can kind of look, so see how when I pull up, see how it pretty much goes to the back of my hand like that? When I see that, I like to do a second treatment on them. So that's kind of my gauge to say you're gonna need 2 rounds. So if I like, you know, pinch like here and this is what it does, then I'm like 1 round, you know, cause does that kind of make sense? So, so I would actually do, definitely we wanna do that again. That is a maybe. This might even be a good another smooth after round 1. Like round 2, round 1 I would do that, and then round 2 maybe like a smooth would probably be good. And I bet it's gonna be this. I bet that we could do the same thing for that. Yeah, cause see like right in here is where we're pinching more. We just don't pinch as much on the side. So kind of, you know, again, even if it's shaped a little different, you know, I think the smooth would be good for round 2. So that would be 3, 4, 5, so 7. So again, what I would probably do is just sell her a package of 8, because we know that that cycle is going to be used somewhere, and that's again, you have a price break at 6, another price break at 8, and then the next price break is at 12. So I would sell her 8 cycles, because that's just going to be a better bet. One's going to sit in an account for her and just kind of wait. So yeah, but I think that would be really good. Okay. Okay, oh wait, we have to do your inner thigh still. So she's probably gonna end up with 12, I
12.
bet. So when I put your legs apart for me real quick. What do you think bothers you more in the front or in the back?
Probably back there.
Yeah, I feel like hers right here. So anytime I'm doing legs, especially because I mean her legs are not very big, I like to do one round, and so when I'm doing, if I'm gonna do sides or abdomens, I do my second round at 30 days. But legs, especially because she's little already, I'll wait at least 3 months before I do something else on the legs because I mean again, if I did like inner thighs, and I'll look at this and see if it would make sense to do that. If I do like all 6, because that's what we want to do that first round, I'll leave it like that. But I wouldn't come back and do her inner thighs the second round until at least 3 months, because sometimes I feel like legs can go pretty fast. Now, if someone's larger to start with, then I'll go ahead and do a second round that, you know, at 30 days. But with her, I would do this second round at 30 days, and I would hold off on doing anything second. And because her legs are not too big, I would just start with one cycle right here. So she does not have, like, she has definition, but there's fat right here still. So it would actually look cute on her to do this. And so this is where your professional recommendation comes in. And because I can also tell by looking at her hips a little bit, she has this right here, okay? Not bad, but if I could take and do this, and then push that up, what would that look like to you?
Yeah.
Is that about what, and it matches kind of the rest of your legs like what you're telling me?
Yeah.
So honestly, that would be my treatment plan for her, is I would do that. And then because, again, I can, just by looking, you can kind of see the, you can see that this is here, but it's like, you can kind of tell her muscles are here. I would also recommend her starting an EmSculpt series, because can you imagine if we Coolsculpt this, right? And then we start EmSculpting it, which is gonna lift it up even more. So then I want you to look at from the side here what I'm doing. So we're gonna push that up, push that, like that. Now see, now imagine if we take and do like a little lift too.
Yeah.
You know? Plus also, which your butt actually looks good from the quote. Oh my gosh.
It's really good.
That looks really good. Okay, so she did quote already for the cellulite. Wow, looks really good. And so again, we know that cellulite is some fat, right? So with you, I would probably do, because we don't want to get rid of too much of your fat right here. So I probably would do the EmSculptNEO with, I'd probably do maybe like every other, do the fat reduction, you know, just to smooth out that last little bit that's right there. But I really just want more muscle build than fat reduction right there. So I'd probably do the first one using the EmSculptNEO, the whole machine with the RF radio frequency for the fat. Then the next time just muscle, the next time RF, the next time muscle, and then just maintenance with muscle and just kind of gauge it and see what we need to do. Because I don't want to get rid of too much fat. I would just want to maybe smooth out that last little bit right there that's going on. But yeah, the quote did really good for you. So, okay, so let's see, what do we say? It was gonna be 1, 3, 4, 5. And then 6, 7 was round 2, and I would sell it like that. I wouldn't just sell 5. The way that I do it, if I know that I need to do a second round for them to really see something, I will not undersell. So like 7 is the treatment plan for that. Like I would not change it at all. So 7 for that. This, because her main thing was just the inner thighs, it's okay if you just do the inner thighs. So I would be okay selling just 2 for that, but to really give her some wow results, I would do 6 right there. Okay, so again, when I'm selling packages, I don't bend on what they have to have, but then I show them, if you could do this is what it's gonna do, this is your best option, but I will be okay doing just your inner thighs. Does that make sense? So again, we do not undertreat at all. That's one thing that we're known for, is to make sure that they have enough cycles to where they're gonna be like, wow, Coolsculpting really works. Wow, EmSculptNEO really works. cause I will not undertreat at all.
Mhm.
And I don't base anything off of money, I base it off of like what they actually need. So 7 treatments is gonna be, or 7 cycles here, either 2 or 6, and then, again, optional would be the EmSculptNEO. And that would, so optional is gonna be this, and optional is gonna be the EmSculptNEO.
Mhm.
So then I would basically price out, you know, all of her different packages. I would say, here's what you do with 7, I'm gonna recommend 8, because now you're gonna save money on that last cycle, you'll use it somewhere, even if it has to sit in her account until she can afford more, she at least has it. And then I would show her, if she did this, plus 2 more 10, you're not really saving anything, but if she bought a package of 12, you save even more than the package of 8. So I would say, I would buy the package of 12, but realistically, we have 7, plus 6, we have 13, so at 13, she would still get the cycle prices if she was getting 12, plus the rebates and all that, so that would really be her best bet would be to buy the 13 cycles. She would get $260 in Ally points. And then when anybody that's doing anybody that's doing 12 cycles or more, we have those $200 rebates.
Oh, okay.
So and then also she's at our lowest cycle price. So yeah, so she locks into that cycle price also for any future treatments. So she would end up being probably spending around a little bit over $6,000 just for the Coolsculpting, with her rebates, and then after that she would and then the EmSculptNEO she would be. And so, and then what we're doing too is if they package up 2 modalities, so if she does add the EmSculptNEO to it, then we would give her a discount of 20% off both packages.
Okay.
So yeah, so if they just do 1 package, if they do 2, like say or if they add a quo in, then I'd give them 30% off of everything. So yeah, because the more that they do, obviously they're spending more, but then we find ways to package them up and save them some money as well. Make sense?
Yeah.
Okay, awesome.
Thanks, guys.
Now it's making me want to like treat y'all. I'm like, okay, y'all ready for treatment
When do we
now?
start?
Okay, hand me a little bit of hand sanitizer, please.
It's there, but it's not.
I know. Pump it up, pump it up, pump it up. Oh,
There it goes.
hello. It's about Mary. Okay, yeah, that's me. Yeah, my mind just goes like, yeah, no telling where my mind goes. Yeah, y'all know me by now. All right. Oh, what?
You already know, because I've told you a million
It's your
times.
butt.
It's my butt and my stomach.
It's your stomach too.
Mhm.
Okay.
I love my shape, but when you made the uneven comment, I am uneven, and I know I'm uneven.
Okay.
I can actually see that when I look in the mirror because I feel like I have a shape already. But yeah, my butt.
Your butt. Okay. So, actually, your butt looks good from where we Coolsculpted right there.
Yeah.
Wow.
It does.
Do we have your after pictures?
Yes, you do.
Cause that looks good.
Mhm.
Wow. Okay. So now all you need is you just need EmSculptNEO then, cause I mean we don't want to Coolsculpt anything else. Y'all see she already got it.
Yeah.
I mean like you can really see that definition right there. That looks good.
Yep.
So really all she needs is just a little bit of a lift. Yeah, I mean that's what the EmSculptNEO is gonna do. It's just gonna lift it up just a little bit.
Yeah.
Yeah, but like the cutest butt ever.
Oh.
So yeah, so a package of 4, and I wouldn't do the RF part. I would just do the
Right.
muscle only. So I would do a package of 4 and just maintenance once a month, and just the muscle only. No fat reduction on that. You actually you're pinchable. You're not even most people back here are. She's actually pretty pinchable. Okay, so look in the mirror, and I'm gonna show you what I think that we should do. Yeah, so I think we should do 1 here, and 1 there. So I think we should get rid, and it's kind of gonna take this little bit of corner off, right? So 2, 1, 2.
Yeah.
Man, you have more, I mean, and that's what, again, don't judge a book by its cover, right? I mean, I wouldn't have ever even thought she needed any Coolsculpting. But I mean, in all honesty, this is where Coolsculpting is fun, because we can make her body look like she's had plastic surgery.
Yeah.
I mean, honestly,
Let's
we
do
could.
it.
We could. I mean, I can get crazy with, this is how y'all gonna see me get crazy.
Mm-hmm.
I would do this, I would do one, if there was no budget,
Mhm.
I would do one there, I would do one there, I would do one there, y'all seeing it?
Mm-hmm.
Yeah.
Cause, and again, we're stacking because we have to, so we don't have that line of demarcation, so 1, 2, 3, I would even do one right there. Y'all, I mean, like, it's
Yeah.
crazy, I never saw
Yeah.
this, so I would do 4, I mean, who would, that's weird, like, right? You don't
Yeah.
see that, but, okay, so let me
This
see
side's
this
not
side.
as bad.
Right.
It's not,
Not that the other side's bad, but they're just so different.
very, yeah, it changes. I would still do 3 on this side
And 4 on that other
and
side.
4 on the other side. And then I feel like we're gonna come back in here and do more,
Yeah.
you know? I would actually, so 4, 3, because of, I mean, you can see we're pinching quite a bit.
Mm-hmm.
I would do probably at least 2 more on the second round, so 4, 6, and then I would see how we heal out. We may not have to do a second one on this round, so definitely this side we need to do more. So 6, 3, that's 9. I'd probably have them purchase one in case we want to go through and do one on here, because potentially we probably at least want to do one, or maybe that might be the smooth or something like that. Just again, because I can still, we're still grabbing at least one area that should have a double. Does that make sense?
Mm-hmm.
So 6, that'd be 10. All right, now let's look at your tummy. And you'd have to take out your belly button ring.
Mhm.
So I would actually do, because again, I mean, she's pinchable, but I would do the EmSculptNEO on her again. I would do the EmSculptNEO
After
because,
you do that cool sculpting, that EmSculptNEO would be fantastic.
yeah, well, I would just start with EmSculptNEO right here because, I mean, she's pinchable, but also we don't really see a whole lot of muscle, and we know what the EmSculptNEO does, so kind of kill 2 birds at one time, you know?
Mm-hmm.
Now, if someone's like quite a bit larger in the stomach, I would debolt first with Coolsculpting and then start the Neo, but I think with her, we would do the Neo on her, and so we're getting rid of the fat and building muscle at the same time. And we also know how Coolsculpting works, is if we're gonna do that many cycles on her, then it's, you know, sometimes it'll still pull fat from here too,
Mhm.
you know what I'm saying?
Yeah.
So I think that would be awesome to do that. So what do we say, 10 cycles of Coolsculpting,
Mhm.
and then 4 EmSculptNEO, and then your maintenance on that.
Yeah.
I think I would like to see her
Oh, and then
results.
4 on her
Yeah.
butt.
And the 4 on my butt.
Yeah, and then the 4 on your butt. So yeah, so she would be 8 EmSculptNEOs and a package of 10 of Coolsculpting, and so we would definitely give her a discount on that. I'd actually should give 30% off because that's realistically 3 different packages. So yeah, we should. I think it'd be cool to do it
My
because
My body is yours.
I mean, honestly, with her, like, we could totally make her look like, and it's weird because she's so little, it just is so
Mhm.
deceiving.
Well, and even when we did my butt, you know, and I would tell people like, hey, I've been cool sculpted before, they would look at me and be like, what did you do?
Yeah,
I'm like, oh, believe me,
Mhm.
believe me.
yeah, so, okay, we'll see. I think we'll try to get some cycles from, I'm going to dinner with Lindsay tonight, so we'll see what I can pull off. Okay.
You're welcome.
Has that helped y'all learn?
Yeah, that
Yeah,
was
yes,
awesome.
yeah,
Okay.
that was
Awesome.
thank you.
Good. So, okay, well, hopefully y'all enjoyed watching us just be here in action. And if you are interested in getting a consult, we don't charge for it. We love doing consults head to toe. So even if it's your body that's not, if it's something else besides your body that's not bothering you, that didn't even make sense. If you have anything else that's bothering you besides your body, let us know. You can, I mean, we do consults head to toe, and we're real big into the hormone optimization. So if you feel terrible and like anything from like low energy, hot flashes, night sweats, mood swings, anxiety, depression, brain fog, walking in a room going, what did I come in here for? Low sex drive. If you are just experiencing anything that you just don't like the way you feel, you don't like the way you look, we're all about solving problems here and just helping you live your best life and just look your best. So give us a call at 830-FAT-GONE. That's a super easy number to remember. And we'd love to get you in. Again, free consult, and we're doing package discounts if you are doing more than one treatment area. So we hope you enjoyed watching us, and we'll see you actually next Wednesday for our laser live demo.
6 o'clock.
6 o'clock
See you there.
on Wednesday. See you then.